You know, we are nowhere close to a national contact tracing program. The House has passed key provisions of the contact tracing legislation that I introduced with Congressman Levin from Michigan, but Republicans in the Senate have refused to provide states with the funds they need to trace coronavirus infections. So let's have one more turn of this. Let's talk about who's going to be hit the hardest if we don't learn the lessons of the past few months. In Massachusetts, we already know data show that Black and Hispanic people in the Commonwealth are 3 times more likely than white people to contract COVID-19. So, Dr. Khaldun, if the federal government fails to right the wrongs of its early response to COVID-19, how will its failure impact people of color and other vulnerable communities that are at risk for the coronavirus infection?
So I think if we don't aggressively address those social determinants of health, so adequate housing, making sure people have access to health care, no out-of-pocket costs for testing, absolutely, African American communities, Latino communities, our tribal communities are going to be the ones that are hit the hardest. So it's something that's very concerning for me.
Well, thank you very much, Dr. Khaldun, and thank you for your work. You know, there's going to be a time and place to take the lessons from this pandemic and apply them to the next one. But right now, as COVID-19 cases top 2.3 million nationwide, our country can't look at the coronavirus pandemic as if it is an event from the past. 120,000 Americans are already dead, and more are dying every day. We must expand contact tracing. We must secure our supply chain. We must protect communities of color, and we must stop pretending that this pandemic is over. Thank you, Mr. Chairman.